Good morning, ladies and gentlemen. Myself Dr. Shilpa Gandhi. मैं thoracic surgeon, मैं consultant thoracic surgeon हूँ, working in Nagpur at KIMS-Kingsway hospitals. आज का हमारा topic है surgical innovations in COPD. So, what is COPD? The technical full form of it is chronic obstructive pulmonary diseases. लेकिन अगर मैं उसको सिंप्लीफाई करूं तो एक लेमैन की भाषा में हम इसको यही कहेंगे कि सांस लेने में ज़रूरत से ज़्यादा दिक्कत। तो एक्सट्रीम जब बहुत ज़्यादा दिक्कत होती है, बहुत ज़्यादा शॉर्टनेस ऑफ ब्रेथ, बहुत ज़्यादा ब्रेथलेसनेस होती है, इट इज़ ए साइलेंट इंडिकेटर और इट्स एन इनडायरेक्ट इंडिकेटर कि आप शायद COPD से ग्रसित है। कैसे होता है ये? So it is common in India. It is definitely common in India. क्यों होता है और किन में होता है? Mostly ये aged, middle aged, yeah, higher aged individuals. So those who are 35 plus, 35 plus of age group, उनमें ज़्यादा होता है। सबसे बहुत ज़्यादा स्मोकिंग करने से, whether it is a cigarette smoking, बीड़ी smoking, most common indication or most common reason to develop a COPD is because of the chronic smoking. इस तरह के मरीज usually ये 1 to 2 bundles, एक से 2 bundle यानी कि 20 to 25 cigarettes per day ये लोग कंज्यूम कर जाते हैं, at least for more than 10 years. So they are so addicted to smoking that down the line in the next 10 to 20 years it gives rise to COPD. COPD के और भी दूसरे reasons है, smoking लेकिन सबसे ऊपर है, but दूसरे reasons होंगे वो जो वर्कर्स जो कोल माइंस कोयले के एक्सपोजर में सबसे ज़्यादा आने वाले, सो कोल माइंस में काम करने वाले या फिर उनके साथ रहने वाले या फिर उस रीजन में रहने वाले, उनका भी पैसिव एक्सपोजर होता है. सो to these kind of ingredients which give rise to COPD mostly. So these factory workers, so these are the common indications, and then किसी में genetic भी होता है. So these are very uncommon indications, right? जैसे मैंने कहा, मेल फीमेल किसी में भी हो सकता है. You just have to be exposed to the risk factors. But of course, it takes time to develop. So it is mostly seen in 35 plus of age group, but most commonly it is seen in, by the time जब symptoms बहुत ज़्यादा evident हो जाते हैं, बहुत clearly दिख पड़ते हैं, the patients are already 50 plus. क्या कहेंगे ये लोग? So what will be their common complaints? Common complaint is they are gasping for breath. Not exactly gasping for breath. They are extremely difficult. They find extreme difficulty in in each breathing, with each respiration. तो सांस लेने में बहुत दिक्कत. And by the time जब ये डॉक्टर्स के पास पहुंचते हैं, some of them actually कुछ मरीज को already oxygen requirement आ जाती है. So they are on inhalers and they are not getting improved, and hence they keep requiring, or they start requiring oxygen, even if it is 2 liters, even if it is small dose. But yes, they start slowly they start becoming dependent on oxygen. These are ये सब telltale signs है. These are all classic but silent markers कि आप शायद COPD से जूझ रहे हैं. तो yes, this is a common complaint, I'll say. And of course कि इस तरह के मरीजों में there will be a history of exposure, है ना. So जो risk factor है शायद उसका clearly indication भी आपको मिले. For example, he might be a worker in some some kind of a factory. So yeah. अब आप सोचेंगे कि सांस लेने में दिक्कत है तो मरीज सबसे पहले तो they will go to our medical the physicians or the chest physicians. Yes, of course they are right. Yes, of course that is actually the start of the treatment, the start of investigation. So these people are already chest physicians say treated either they are under the treatment or under the care of chest physicians. So what we do is I mean, they're already on inhalers. They might already be on oxygen, some small amount of oxygen. ऐसे मरीजों को रिकरेंट इन्फेक्शन के भी चांसेस ज़्यादा रहते हैं, इसलिए दे माइट गेट एडमिटेड इन द हॉस्पिटल फॉर स्मॉल स्मॉल ड्यूरेशन, जैसे कुछ दिनों के लिए फॉर ट्रीटमेंट ऑफ चेस्ट इन्फेक्शंस. सो ये सब भी कॉमन है. फ्रीक्वेंट हॉस्पिटलाइजेशंस आर आल्सो नॉट अनकॉमन. अब आप पूछेंगे कि सर्जन का क्या रोल है, थोरासिक सर्जन का क्या रोल है. यस, दैट इज डेफिनेट रोल ऑफ थोरासिक सर्जन, इवन दो इट इज फॉर lesser amount of time, or even though it comes a bit later. So thoracic जैसा मैंने कहा, when they're investigated, so इनके रूटीन जांचें होती है. इनका most importantly, what do we find when we investigate these patients? तो जो lung function टेस्ट्स होते हैं, है ना, जो सांस लेने के जो क्षमता होती है, इनको एसेस करने के लिए डिफरेंट पैरामीटर्स होते हैं. मोस्ट ऑफ दीज पैरामीटर्स दे आर deranged in these patients. Deranged in the sense they are abnormal, they are extremely abnormal in these patients. And again, this is a telltale sign or a marker कि ये COPD तो definitely है, लेकिन they need further either investigation or further treatment, further a definitive treatment. Then here comes the role of a thoracic surgeon. So जैसे मैंने कहा कि बहुत ही क्लासिक, बहुत लेट आता है रोल thoracic surgeons का, but yes. So what do we do? Most of these patients, they have, हमने देखा scans में mostly patients में छोटे छोटे एयर पॉकेट्स होते हैं. Most of these patients, they have air pockets on both the sides, on both opposite sides. I mean, like on both the sides of the lungs. Mostly इनको हम सर्जरी द्वारा रिमूव करते हैं. की होल सर्जरी द्वारा रिमूव करते हैं. इसको हम टेक्निकल टर्म में LVRS कहते हैं, और लंग वॉल्यूम रिडक्शन सर्जरी. ये हम क्यों रिमूव करते हैं? बिकॉज ये जो एयर फील्ड स्पेसेस होते हैं, या जो छोटे छोटे जो बुल्ले होते हैं, ये रेस्पिरेशन में या ब्रीदिंग में पार्ट नहीं लेते हैं. एंड इनफैक्ट दे पार्ट नहीं लेते हैं, बट जो ये ब्रीदिंग की जो एफर्ट होती है, द कंप्लायंस जिसको हम कहते हैं, या जो एफर्ट है, द ब्रीदिंग एफर्ट, वो उसको प्रभावित करते हैं, वो उसको बढ़ाते हैं. इसके लिए मरीज जो है उसकी सांस लेने में उसे दुविधा होती है ना, बिकॉज part of the lungs, they're not contributing to respiration, but they're also increasing the effort of the breathing and the compliance of the lung. So इसीलिए the commonest or the first most indication of surgery, I will say, or the first most reason is to remove these part of the lung which are not contributing adequately to the respiration, जिसको हम lung volume reduction surgery कहते हैं. Most of these patients actually इनके सारे investigation parameters mostly deranged होते हैं. Some of them are actually on oxygen. ये लोग ऑक्सीजन पे डिपेंडेंट भी होते हैं. लंग वॉल्यूम रिडक्शन सर्जरी से क्या होता है? फायदे ये होते हैं कि लॉन्ग टर्म में देखा गया है कि ये मरीज की जो सर्वाइवल है, जो सर्वाइवल क्षमता, लॉन्ग टर्म ये जो द लाइफ स्पैन, इसको ये सिग्निफिकेंटली इम्प्रूव करता है. क्वालिटी ऑफ लाइफ को सिग्निफिकेंटली इम्प्रूव करता है. बहुत सारे काफ़ी मरीज जो है उन्होंने उनका ऑक्सीजन रिक्वायरमेंट निकल जाता है. So and hence, these people, they are able to live longer and with a better quality of life without requiring oxygen. Secondly, so lung volume reduction surgery is this, and it's a very classic indication for performing a lung volume reduction surgery, and it has lots of benefits. What is the second role, or what is the second surgery that we can do? So the second surgery that we can do is a lung transplant. Lung transplant ये वो मरीजों में होता है जो lung volume reduction surgery से भी benefit उसके बेनिफिट्स या उसके फ़ायदे उठाने में सक्षम नहीं हैं। मतलब इनकी सिचुएशन, इनका ऑक्सीजन रिक्वायरमेंट इज़ वेरी हाई, इनकी जो साँस लेने की क्षमता है वो और भी पुअर है। So these are the kind of with very extremely poor PFTs, and they are not qualifying for even even lung volume reduction surgery. So इन सब मरीजों में ट्रांसप्लांट एक बेहतर ऑप्शन है। ऑफ कोर्स ट्रांसप्लांट में बिकॉज क्योंकि अंडरलाइंग जो फेफड़े की जो सांस की क्षमता है वो ऑलरेडी अफेक्टेड होती है, तो ट्रांसप्लांट्स में वी जस्ट रिमूव बोथ द लंग्स एंड देन वी जस्ट put in new lungs altogether. So of course it is I'll say it's a last option, but but then yes, in a very very extremely poor efforts or in extremely critical patients, this can be the only life-saving option, and that is lung transplantation. But yes, if I have to say, then the surgeons do play a major role in COPD, and these are the only two innovative, or not innovative, but these are only two existing surgical options available. So west में there is another option, and that is to put in a valve. एक valve होता है, तो ये बहुत छोटे छोटे जो सांस की जो नलियां होती है, bronchioles, bronchi, इनमें जो 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 लंग का जो हिस्सा सांस लेने में कंट्रीब्यूट नहीं कर रहा है, उसको वो उस हिस्से पे उस सांस की नलियों पर एक वाल्व फिट किया जाता है एंड उसे ब्लॉक कर दिया जाता है, एंड दैट इज नथिंग बट bronchoscopic LVRS और endobronchial valves. अनफॉर्चुनेटली ये इंडिया में उपलब्ध नहीं है, ये सर्विस इंडिया में उपलब्ध नहीं है, ये वाल्व्स और ये पद्धति इंडिया में उपलब्ध नहीं है, इसीलिए जो certain section of patients hai, they are unfortunately deprived, or they can't have this treatment. But yes, in the west, so western region mein COPD is again very common, and hence the bronchoscopic treatment is also not uncommon. So yes, I think yes, I have already told you. So the three options, or the three surgical options, are by surgery, by keyhole surgery, जिसको हम VATS कहते हैं, that is the lung volume reduction surgery. Then second is in second जो है वो और भी complex patients में और भी critical patients में, then the best way is actually to do a lung transplantation, है ना, जो जिसमें हम दोनों lungs को remove करते हैं, and then we replace it with a newer lungs. And then the third option is of course to put in a valve, but unfortunately ये जो third option है ये भी इंडिया में available नहीं है. So yes, I think to conclude what I would say, conclude या खत्म करने के पहले मैं यही बोलूँगी कि COPD, living with COPD is extremely tough, extremely difficult, and is a huge it's a huge suffrage to the patient. So I think instead of suffering, जो patients should also instead of suffering whole life or the remaining life, I think we have now good surgical options available. एक उम्मीद, that we have a ray of hope that you might actually be in a position to improve your quality of life, and get rid of lot of symptoms, get rid of oxygen, and hence I think मरीजों के लिए मैं यही कहूँगी कि instead of opting to suffer for whole life, you should opt for some surgical options if you're not finding, अगर आपको उनकी मेडिकल ट्रीटमेंट से रिलीफ नहीं मिल रहा है, एंड आपकी सिम्टम्स अगर फिर भी बढ़ते जा रहे हैं, तो मगर yes, so this is a reminder. You have to you have to know this is an awareness talk, of course. So it's not just an awareness, but it's also a reminder that yes, there are some surgical options available, and whether anyone suggests you or not, I think you should also be aware of the availability or the options available, and you should seek help from the right people. So yes. That's why we've written, like, transforming COPD care. So yes, surgical options when we're selected, or when we choose it for selected patients, it can really transform lives, or the remaining lives. So I think, yes, I would like to conclude my talk, and I'm open for any questions. So I think Ms. Kumari has asked, how can healthcare systems optimize resources and pathways to facilitate timely access to thoracic surgery for COPD patients? Yes. So इसके लिए एक बहुत ही अच्छा सिस्टम है, जिसको हम इंग्लिश में कहते हैं MDT, मल्टी डिसिप्लिनरी टीम मीटिंग. सो आई थिंक अगर आपके हेल्थ केयर सिस्टम, आपके इंस्टीट्यूशन में अगर इस तरह के मरीज काफ़ी आते हैं आपके आपके रीजन में, वट एवर, सो इन योर होल सेंटर, all these patients should be subjected to MDT. MDT means a group of, MDT is nothing but a meeting which is chaired by group of doctors. Mostly in this case it is in LVRS MDT or in COPD MDT, it is mostly pulmonologists, which is physicians, then radiologists or thoracic radiologists and thoracic surgeons. These are the only three people who usually sit, because you're the only specialists who can take care of these kind of patients. So they should sit in every MDT. This MDT should happen at least once a week, and we select and we screen and select patients, and see if they are suitable for medical treatment, or अगर वो already या फिर अगर वो already medical treatment में हैं, so then are they benefiting from it? And if they're not benefiting from it, then are they good candidates for surgery? If yes, then what kind of surgery are they really good for? A simple keyhole VATS surgery, or या तो फिर अगर वो बहुत ज़्यादा advanced disease है, advanced symptoms है, then they have to be screened by a proper transplant team and see if they can be fit for transplants. So yes, we, in this way, I think this is the best way of optimizing resources for good COPD, for good care, or the timely care of COPD patients. So yeah, there's another question, and that is, what tests do I need to confirm I have COPD? Like I said, most important is, of course, the symptoms. Symptoms, आपको एक telltale sign, symptoms are a silent marker that you might be actually suffering from COPD. Symptoms में most commonly they are shortness of breath. आप efforts आपके बहुत कम हो जाते हैं, which means कि अगर आप कल तक के 3 floors 4 floors चढ़ सकते थे, without any without requiring rest, so today it has fallen down, or it has reduced to just one flight of stairs. So मतलब एक floor के ऊपर आप, you cannot walk, or you cannot climb the stairs. So these efforts, your personal efforts, they go down. Then investigations may, of course, oxygen requirement ho jati hai in patients ki. Some of them, they start requiring BiPAP. BiPAP ek chota, it's kind of a mini ventilator, you can say, or a non-invasive ventilation in the form of a BiPAP. Most of these patients, they might require BiPAP as well, or an oxygen. Then the third, I will say, just मैंने बोला था, lung function test, which also we also call PFT. So this is, I think, the most important investigation, and that is PFT, which are mostly, ये mostly abnormal होते ही हैं COPD, advanced COPD patients में. There are some other indications to find out अगर कि ये genetic तो नहीं है, मतलब इनका जो lung की क्षमता का शायद, it is genetic, पहले से ही इसमें there has been a damage, like for example alpha-1 antitrypsin deficiency, and so इन सब के factors को हम blood markers and all इसमें देखते हैं, and that is these are all certain blood investigations to find out if whether it was genetic. So yes, these are the tests we need to confirm. Like I said, so what medications can help me breathe easier? Just हमने पहले बोला, mostly these patients, they are already under treatment by chest physicians. Chest physicians, they commonly, आपको अच्छा antibiotic to clear your chest infections. So chest infections को अगर आपको है recurrent या intermittent बार बार chest infections हो रहे हैं तो आपको antibiotics का ज़रूरत होगा. Then सांस लेने की दिक्कत है तो मोस्टली पेशेंट्स को इनहेलर्स लगते हैं, सो ब्रोंकोडायलेटर्स, इनहेलर्स या पफ्स ऑफ मेडिकेशंस, सो ये उनको ये भी लगते हैं. एंड तीसरा से ऑक्सीजन मोस्ट ऑफ दीज पेशेंट्स ऑक्सीजन या तो एडमिट होके या तो ऑक्सीजन इन द फॉर्म ऑफ बाईपैप मशीन्स होते हैं या फोर्सफुल ऑक्सीजन की जरूरत पड़ती है इनको. Yeah, so I think it's a good question. What is endobronchial valve therapy and how does it benefits COPD patients? So endobronchial valves, जैसे मैंने कहा था, it's a valve. It's nothing but a small valve. Just a heart में हम लगाते हैं valve. So just like that. So there's a valve which you need to put it in their lungs as well. It is very common. It's a very common therapy in the West. Unfortunately, it's not available in India. तो इसमें हम दूरबीन द्वारा ये जो valve है ये पहले हम assess करते हैं if the patients are fit for valve therapy. Once they are fit for valve therapy, then कहाँ पे valve deploy करना है. So those part of the lungs जो बिल्कुल contribute नहीं कर रहे हैं breathing में, उसके छोटे छोटे जो air जो wind pipe, छोटे छोटे जो air pipes है या wind pipes है, bronchioles, very small bronchi and bronchioles, उसमें हमें valve fit करना होता है. So that is the endobronchial valve therapy. Again, it's a very established treatment modality for only a selected group of COPD patients. Is pulmonary rehabilitation a good option for me? Yes, it is a good supplementary option. Most of the COPD patients इन लोगों को एक अच्छा pulmonary rehab is required along with your medical treatment, along with your surgery, and it's for a long term. Basically, अगर हम किसी patient को surgery के लिए even if the patient is fit for surgery, we make sure कि they have or they get उनको एक अच्छा pulmonary rehab मिले for at least for few months, for 4 to 6 months. इससे क्या होता है कि surgical outcome successful होते हैं, surgical outcomes get improved. So yes, pulmonary rehab is a must, but it's a supplementary option. It's not the primary treatment. It's not a treatment option. It's supplementary. It's supplementary to the medicines. It's supplementary to the surgery. What exercises safe for someone with COPD? Yes, I think I would have loved having a physiotherapist with us in this talk. I would say deep breathing exercises, of course. What special type of deep breathing exercises? I think this will be best explained by the pulmonary rehab team, जो कि it is best dealt with by thoracic physiotherapists, or the physiotherapists who are specialized in taking care of these kind of patients. What are other lifestyle changes that can I make to manage my COPD? Yes, very important is quit smoking. This is the biggest lifestyle change. Quit smoking as soon as you're diagnosed of COPD. जैसे ही आपको पता चलता है कि आपको COPD है या फिर आपको symptoms आ रहे हैं उसके, you have to quit smoking from that day itself. Smoking, chronic smoking, if I have to say, it reduces life of a patient, by 13 minutes. Each cigarette, it reduces the life of a patient by 13 minutes. All right. So अब आप समझ जाइए कि मैंने जो कहा था 2 packs is nothing but 25 cigarettes. So what will be the impact of it on your entire life expectancy? Silly, the first lifestyle change I would say is quit smoking. The second lifestyle change I would say is prevent chest infections. So as much as possible. So you have to prevent chest infections, or you have to take care of yourself in such a way that you should not be exposed to over-infective areas. So you have to prevent chest infections. How can thoracic surgeons contribute to multidisciplinary approach in COPD care? जैसे मैंने कहा, आई थिंक thoracic सर्जन्स का रोल है, significant role hai in selected group of patients, and but mostly it's a multidisciplinary care, which means uh, it's a multidisciplinary approach, means that it's a combined role along with a group of physicians or chest physicians who are taking care of these patients regularly, and of course along with the other people who are involved in diagnosing these patients, for example radiologists. So yes, so I think 2-3 people went together, so then that's how you give the best treatment to the patients. Can I still travel with COPD? Of course, you can travel. It depends if you are on. You can travel if you're not on, not oxygen dependent, or you're not on any long term, like the machine, non-invasive ventilator. जैसे कि अगर आप BiPAP machines पे नहीं है, आप oxygen requirement नहीं है आपके, of course you can travel. Um, so I think we do not say, हम ये कभी नहीं कहते कि आप अवॉइड एयर ट्रैवल अवॉइड कीजिए, है ना. But yes, if you have to be full covered, you have to take all your inhalers and medicines with you, of the antibiotics and all of that, full bunch of medicines, and then of course you can take even the air travel you can take. Chances होता है लेकिन कि ऐसे patients को कभी कभी emergency आ सकती है, in the form of some pneumothorax, कोई जब एक air pocket है, जब when it bursts, it gives rise to pneumothorax. So that has to be kept in mind. Of course बाकी the road travel by road by train is of course is possible. अगर आप oxygen dependent नहीं है तो of course it is possible. Is there anything I can do to slow the progression of COPD? जैसे मैंने कहा, you have to be taking, your medicines sincerely. Do not default the treatment. Treatment default नहीं करना चाहिए, है ना. So whatever medicines you've been prescribed, you have to take it. All the precautions which we've mentioned in the past, वो आपको follow करने हैं. I think you can slow the progression. Slow the progression means you can control it. You can keep it under control. But having said that, जिनमें ये despite all the efforts, अगर आप control नहीं कर पाते हैं, है ना, then that's where the role of the surgeon comes into picture. Is there any ongoing research into new surgical techniques for COPD? So I think, like I said, there are constant researches happening on different types of valves. तो the valve therapy जिसको हम bronchoscopic therapy कहते हैं for COPD, तो उसमें ज़्यादा researches हो रहे हैं. जैसे whether you put in a valve or different type of coil or different type of whether you ablate, मतलब उसको आप जला दीजिए, स्टेंट डाल दीजिए, सिकुड़ा इसको, so that वो सिकुड़ जाए जो छोटी छोटी जो विंड पाइप्स है, या फिर different types of valves. So these are mostly the researches are all happening on those segment of surgical techniques for COPD. How often should I see my healthcare provider for COPD monitoring? I think there is a standard pathway. Usually, हम इन मरीजों को, see, the pulmonologists, they usually see these patients, or chest physicians, they see these patients on a monthly basis. But once they become a surgical candidate, we see them every few months, and हम लोग monitor करते हैं कि इनका rehab कितना अच्छे से चल रहा है, and how good they are tolerating them, and have they now become fit for surgery. Once they become fit for surgery, then we operate them, of course. लेकिन ऑपरेशन के बाद भी हम इन्हें काफ़ी लॉन्ग टर्म तक मॉनिटर करते हैं to see if the surgical outcomes have been achieved, and how well they have tolerated the surgery, and should we supplement with them with something else otherwise as well. So I think key patients, they need a long term monitoring. I will say that they definitely need a long term monitoring, treatment के पहले, ट्रीटमेंट के दौरान और ट्रीटमेंट के बाद भी. So yes. Can COPD be prevented and can surgery cure COPD? Like I said, COPD can be prevented अगर आपको उसके risk factors पता है तो. अगर आप उसके अब if you're exposed to the risk factors, you remove the risk factors and COPD can be prevented, of course. लेकिन अगर वो genetic है, that is something you can't control. So आप उसके ऊपर आपका control नहीं है. Can surgery cure COPD? मैंने कभी ऐसा claim नहीं किया कि surgery पूरा क्योर कर लेगा. I always said throughout the talk that it will control. It will control COPD. It will control, but it will give some added benefits. One of the added benefits, survival benefits, सबसे important है. Whatever we do, we only do so that the patients live longer. So there is a possibility, not the possibility, the data as well as the experience. They both show कि इस तरह के मरीज लंबे समय तक के जी सकते हैं, मगर क्वालिटी ऑफ लाइफ की इम्प्रूवमेंट के साथ. सो ना सिर्फ लंबे समय तक ये जी भी सकते हैं, बट ऑल्सो इनका क्वालिटी ऑफ लाइफ जो है वो भी इम्प्रूव होता है या होता रहता है. इट्स बेटर. So yes, I will say that COPD can be prevented if you are not exposed to the risk factors, but surgery can control COPD, but I think it's very difficult to cure it. Then the last option, transplants, probably that's the only last option in very critical or very advanced patients. Are there any non-surgical alternative for treatment of COPD? I don't think so. जैसा मैंने कहा, and valve therapy है, it is still a semi-surgical or a surgical option. I will say it won't be coming under the category of non-surgical alternative, but it's a good alternative for treatment of COPD. Can environmental factors worsen COPD symptoms? Yes, of course. Pollution. We are living in India. Almost every other city is becoming a metro city. So vehicles have increased massively on the roads, and the environmental pollution is a major factor, which we need to take care of. So I will say yes, the environmental pollution can worsen COPD. It can indirectly contribute as a risk factor to the COPD as well. So environmental factors, I will say environmental pollution is can worsen COPD, can contribute to COPD, can also be one of the risk factors for COPD. What is the full form of COPD? Somebody has asked on a private conversation, and that is, I said, chronic obstructive pulmonary disease or chronic obstructive lung disease. What role do minimally invasive procedures play in the surgical management of COPD? जैसे मैंने कहा था, we do VATS, LVRS. VATS is nothing but the keyhole procedures, and इसमें हम जो वो segment है, lung के जो segments है जो contribute नहीं करते हैं सांस लेने की, जो breathing में contribute नहीं करते हैं, उसे हम remove करते हैं. So that is the surgical, or this is the role of minimally invasive procedures in the surgical management of COPD. Thank you. So I think, yeah. Thank you so much. I think so. It's been a very lively and lovely audience, and we have. I hope I've been able to clear all the queries, or as many queries as possible. It's this subject or this topic is not that somebody would talk about as far as thoracic surgery is concerned. So I think this was a very important topic to provide awareness and information. Thank you so much. I'm really glad to be a part of this talk. Thank you.